What are some of the historical factors that have engendered this lack of trust between physicians and patients?
Yeah, there's one very big blemish in our nation's history when it comes to our research on Black patients. Earlier in this century, and this has built a lot of the mistrust that now exists today. Earlier in the 1900s, between 1930 and 1970, there was a famous study called the Tuskegee Syphilis Study. And it was commissioned by the U.S. Public Health Service in collaboration with Tuskegee University in Alabama. And the objective of the study was to follow men with syphilis and to understand the natural history of what syphilis can do to you without offering any treatment. This was completely unethical because treatment became available in the 1940s.
Because what kind of men were these?
These were poor Black men in Alabama. They were sharecroppers. They recruited about 600 of these men and told them the study was going to last 6 months. It lasted 40 years. And they followed these patients to see what would happen to them with untreated syphilis. All kinds of skin problems, then they would have cardiac problems and neurologic problems and eventually die. Yet, by the 40s, they had penicillin, which was still to this day the #1 treatment for syphilis. But they didn't offer it to them because they wanted to learn about the natural history. It was an awful, awful moment in our history. It didn't even become public until 1972, and when it became public, it shut down. Because of this very unethical research on Black men, it's not very much of a stretch to understand why the Black community, Black men in particular, but the Black community has a grave mistrust of the healthcare system. That kind of history doesn't die quickly. Because of that horrible, horrible event, 7 years later, the United States took action in protecting human subjects in all kinds of research. And to this day, they have continued to regulate very heavily any trial in America that involves studying human beings, even if it's not directly involving a human subject to take a medicine, if you will. If it's just looking at their charts to understand their medical problems and treatments, all of that has to go through an institutional review board at every academic medical center and drug company in the country because of this lack of consent that patients didn't have in the Tuskegee trial and the inability for the right thing to be done for so many years. These days, if you're testing the effect of a medicine, if it shows to be very effective, significantly so in a study, anywhere in the world, they stop the study right then and say, we can't any longer not give this medicine to the people in the study who are receiving a treatment that is a placebo, because that's unethical. We now know that this is effective. That wasn't done in Tuskegee. And that, I think, created an enormous amount of mistrust. And as we said earlier, when you have mistrust, why should you listen to us? Why should you come to me? And so one of the things that we're also trying to do is say, well, who do you trust? And how do we connect with the people that you trust? And how do we better convey information now in 2019, say, where we are just trying to give you the best information that we have available. It doesn't matter what your ethnicity is, but we want you to trust that we're not trying to experiment on you,
right?
That we offer this treatment to everyone.